radiation is the gift that keeps on giving because it damages the DNA. So you treat 54 and 10, the two radiation frequencies, that causes DNA damage, which causes the immune system to recognize it as foreign, which causes ongoing inflammation, which causes ultimately scar tissue.
Thank you for subscribing to the Frequency-Specific Microcurrent podcast. FSM is a breakthrough tool for medical practitioners who feel stuck with limited treatment options, especially for complex issues unresponsive to conventional care. FSM training is the best continuing education course for medical practitioners. Get our free introductory webinar at frequencyspecific.com/about or find FSM trained practitioners at frequencyspecific.com/find. Here's Dr. Carolyn McMakin.
Hi, guys. Chat was disabled, but now everything's okay. Good. Kim is on a plane taking her daughter from Deerland. Annie has the most amazing deer in her backyard. And I am in Hilo, Hawaii. And when Derek gets on, I'm going to have to tell him why I didn't stop and see him while I was in Hilo. And that was because I was meeting with somebody who's going to be organizing our core seminars in the UK in a functional medicine community. So it's just me because Kim is taking her daughter to Canada for a gap year to play hockey, I think. So this background is I'm in an Airbnb with Christy Hughes and her team that does workshops on the Big Island. And I'm rocking the camera, so I hope I don't make any motion sick. So I'm in an upstairs room, and that's my view as I sit here looking or working. I've been putting this off for almost 2 years because I couldn't arrange the time in my brain and the space to update the custom care mode bank, which should have been done like 10 years ago and then really needed to be done for the last 5 years. So I'm updating the standard protocols, adding some new ones, like some of the single frequency combinations where you don't need a name for it. You just, if you don't know what 124 and 77 is for, you probably shouldn't own a custom care, but that's just me being, me. But there's also a protocol for Ehlers-Danlos that includes 40 and 10, and so it runs 2.5 hours. Or if you have three custom cares, you can run 124 and 77, and 40 and 10 will be a single frequency combination. And then there's either concussion in vagus or vagal tone. So it's been fun to see how much everything's changed in the last, since we did the last update. Yeah. So extremity joint. I guess I can ask you guys, you can be there's, enough, there's 16 of you. Do you want like extremity joint? Does everybody know what that is? Acute, week 1 to week 4, and then extremity joint chronic? Or do you want to keep those and add things like ankle sprain, knee injury, knee pain, hip injury, hip pain, shoulder injury, shoulder pain, wrist, and that's an extremity joint's an extremity joint, but some joints have labrums, and some joints have a lot of cartilage, and some joints have a little bit of cartilage, and some joints have the ankle is all ligaments, not much connective tissue except for the retinaculum on the medial side. So I'll add tarsal tunnel if it's not on there. I have all these in my mode bank. So I've got two computers next to each other. I get up in the morning at about 6-ish because we're 3 hours behind. So it's noon here, 12:03. And get up at 6. I have coffee and some breakfast. And then I come back up to this table and start sitting at a chair and working on my 5-pound PC that just has the standards. So I'm updating the standards. Okay, Denise, separate joints would be helpful. See, that's what I think. Enhanced, yes, I have DOMS and I have DOMS long. So I've added that. And I guess I could keep all alone. Hi, Leaf. Actually used the acute sprain on myself in the last 2 weeks after stepping in a whole poppy. Yeah, don't you hate it when you do that, Klein? And then I found out that, so like leaky gut, I've gotten up to GI leaky gut, and they're still under the G's instead of the L's. So I guess I could create two versions, one that's GI leaky gut and one that's just leaky gut. So it's easier to find. And found out that the vagus isn't in any of the GI protocols, because when I first made the custom care mode bank, when I first made the custom care mode bank, we weren't treating the vagus. And no, Danielle, the mode bank has not been updated since the 3.0 software came out a few years ago. So the way it's going to work is I send the standard mode bank to the software programmer, and he changes. So there's a little indicator that tells him I've modified the protocol. And then he changes the standard. And the next time you open the software, the standards, the ones with the little check marks on it that you can't change, the standards will automatically replace the standards that are in your mode bank. They will be updated. If you don't like the updates, you can open them, clone them, and modify them and put them back the way you like them. And our deal with the software programmer is that the software has been designed so you don't lose the specialty programs that you've developed. And this will be very good news for David Hickey, who never is on the podcast, but I'm assuming all of you have specialty programs that you've put in. Thinking about what are the do not use programs? Oh, those should have gone away. Patricia, save the current versions you like as a custom protocol, Kevin says. What are the do not use programs? I don't remember, but they were so bad that I didn't want anybody to use them. And that's on the really old version. It sounds like you don't have the 3.0 software. It's so much better. Call the PDI office or email contact at Precision Distributing and ask them if you do have the 3.0. The do not use programs I've gotten past the D's, so I'm into the G's because I just did the gallbladder and the GI stuff. Do not use, I didn't run across those in the D section, so I don't know. They were programs that had stuff in them probably 81 and 89. I'm going to guess. Call Danielle and ask her if you would. Patricia, Lisa, can it help restore lymphatic flow? Yeah. I had my tonsils removed, Epstein-Barr, strep when I was younger. Do lymphatic self-massage, dry brushing, started exercising, swollen and sore in my neck, armpits, and inner thighs. Okay, that does sound like an active infection. So whoever did your tonsils, or perhaps your GP, is your next stop. That shouldn't happen. Tonsils are lymphatic tissue, and they are a reservoir, especially for strep. And have you only been doing lymphatic self-massage and dry brushing since the surgery? Recently. So since the surgery, right? Well, it could be that surgery was a long time ago and you have all these swollen lymph nodes. Yeah, I would go to see your GP, and antibiotics, there's a place for them, that's for sure. Swollen and sore lymph nodes are not normal. And we can run scarring in the lymphatics, congestion in the lymphatics, and you put a contact around your neck and you put a contact, well, down at your feet, actually. Are your ankles swollen? Or just the lymph nodes in your groin and your armpits? That's not, I'd at least get a CBC, complete blood count, to see what your white count is and see if it's elevated. And if it's elevated, you need antibiotics. We don't know where the infection is. Probably show all four. Yeah, get your white count, and sometimes your ankles are swollen. So if there's an infection that starts like in your tonsils, they take the tonsils out, and the tonsils are like a reservoir. The reason a 30-year-old gets their tonsils out is that it's a reservoir of strep, especially, and that's dangerous. And if they're sore and swollen so long after your tonsils have been removed, something's not right. We can treat scarring in the lymphatics, vitality in the lymphatics, congestion in the lymphatics, inflammation in the lymphatics. If they're sore and swollen, it's an infection until proven otherwise. I would get on something broad spectrum like erythromycin or augmentin or something. The other question would be, what? Okay, they've always been swollen, like for so long. Yeah, that's not normal. Let's get a white count and then we can talk. So if your white count is low, normal, if it's in the normal range, on the low end of the normal range, then we know you don't have an infection, and this is just your lymphatic system doing what it's supposed to, which is picking up the bugs and taking them someplace where the immune system can beat up the bugs and kill them. And then they're supposed to go to the spleen where they get recycled. I think it's the spleen, and sent out. So treat, and if everything's swollen, I'd probably do congestion 50, that's safe. And it's leaking, so 124 torn or broken, 18 leaking, it's not bleeding, it just leaks. And then vitality in the lymphatics, and polarize it, neck to feet, And while you're running the current, so 13 on channel B and congestion 50, torn or broken or leaking, and 49 on channel A, neck to feet, polarize it positive, and someplace between 150 and 200 microamps, and do your lymphatic drainage. There's a question, how swollen are you? And where? Connecting the spleen. Oh, so you must be an acupuncturist. So you can also run from an acupuncture point of view. You have, if you do pulses, so this spleen deficient, kidney deficient, which kind of makes sense, right? Spleen and kidney are connected. They're both yin. And then, but the lung in acupuncture is the mother, air quotes, of the spleen. So you can do spleen chi. So 35 is balancing. So you don't know whether the spleen is deficient 321 and 49 with 13 the spleen, or if it's hyper, which is unlikely, but if the spleen points are sore, you have to ask why. So you could do just balancing the spleen. That tends to normalize the pulses. Balance the kidney, because whatever you send through the lymphatics and through the spleen has to go through the kidney to get out. And in an acupuncture framework, thank you, Pat Lawless and Sandra Megan, for teaching me this. In an acupuncture framework, the lung is the mother of the spleen. So once you balance kidney and spleen, you have to support the lung meridian energy system to balance the whole thing. Nodules, wait, you can feel nodules in your neck and you thought it was normal. Okay, that brings us to, do you have any root canals? So if the nodules in your neck are here under the jaw and and they're swollen and tender, and then all of your lymph nodes are swollen, you still need a CBC. But a jaw infection from a root canal will not raise your white count because the immune system can't get at it. It inflames the immune system, regulates it. That's what caused my heart stuff. So I'm pretty educated on this. I've had 9 jaw surgeries to take out 6 or 7 root canals that were all infected, like my jaw was infected. So CBC first, then a 3D cone beam. So yes, I am talking about the catchword for it is cavitations, but that's infections in the jaw. And that is enough to make these swollen and your armpits swollen. If it's gone to your groin, there may be something else going on. I have a friend that had cellulitis infection in his leg, and it turned out that it was from his root canal. So he had an infection in his jaw, and that led, in his case, he got cellulitis, just a random infection in his leg. And for me, first thing that happened was I got a random infection in my gallbladder and thought it was just my gallbladder. And then the next time I had a root canal, 3 months later, I had a widowmaker lesion in my heart. That was my open heart surgery. That's why we don't mess with swollen lymph nodes. So there's a process. So find out if it's an active infection, an active infection by getting your white count. Then get a 3D cone beam to find out if the jaw is the source of your infection. Yeah, it's, and you can treat the acupuncture points and the lymphatics, but FSM frequencies are not adequate to kill bugs. They just change the signaling that the bacteria create. And if you have an infection in your jaw, that's a different project. Sherry Gallison had her hand raised, and I don't know how to work this thing. There you go. Interested in root canal issues. I have a tender root canal, for 2 years, which cone beam shows no real infection. Oh, for God's sakes. Okay, the cone beam shows, I love this, no real infection. If there's a dark area under the tooth, that's an infection. Get somebody else to read the film, or yeah, that is just hilarious. He's either got old software or he doesn't. If he's not an oral surgeon, he's not going to make any money by taking the root canal out, because that's what has to happen. And they are taught, save the tooth. And the dark area, yep, pull. You have to understand, I have a particular perspective on this that's different than most dentists, except for maybe Mary Ellen. My root canals almost killed me. So when I say Mary Ellen Chalmers saved my life, that's what I mean. She ordered the 3D cone beam. She said, you have no risk factors. You shouldn't have needed open heart surgery. We have to keep looking. And I had open heart surgery in 2007. We did a regular CT scan in 2008. We did a 3D cone beam in 2009. And the back half of my jaw on both sides was infected. So I went a year and a half, 2 years without any molars because they were all on the back. And so we just pulled them. But then they put in bone grafts that have to heal before you can put in implants. So make sure the implant is ceramic or titanium, and don't let them do the removal and the implant on the same day, because there are some dentist offices that are now celebrating that they can do this for you. And that's insane, because you have to have the bone be not infected. So they need ozone. Basically, it's a bone infection. So I was on antibiotics for 6 years to clean up the infection that went up, that ate through the floor of my sinus. This infection cleared up pretty fast. But so I don't want to take antibiotics. Okay. How do you feel like open heart surgery? So yes, go get implant on reclassed for osteoporosis. Yeah, no, it's the GI issues. What turns off the vagus, folks? Come on, quick quiz. Infection, stress, and trauma. Jaw infections count. Sinus infections, mold, count. So when you find somebody with GI issues, it's a thing. You have to look at the vagus, then you have to look at what turned it off, infection, stress, or trauma, and then find out. Yeah, that's one of my hot buttons. It's just enlightened self-interest on my part. Oh, mold plus MCAS. If you have MCAS, your vagus isn't working, and you have leaky gut, implant on the upper jaw, and it was okay. I'm not sure what that means. Yeah. Okay. Lori, trying to support my husband during radiation series, 2 years. Ooh, post-prostate. Ooh, eek. Don't want to interfere with treatment, like to minimize damage to bladder, rectum, keep the rest of him healthy as possible. Oh, what's interesting is we have that one study that shows, you're welcome, Sherry. We have that one study that shows that if there is active tumor while the patient is receiving radiation, The frequencies that FSM uses for radiation and inflammation reduce the pain, inflammation, and collateral tissue damage and scar tissue, but it doesn't increase tumor growth. So if you treat him for, where'd you go? So if you treat him, there you are. So if you treat him for the radiation burns, because after the radiation comes scar tissue in the rectum, the bladder, the urethra, it's not pretty long term. You can run inflammation in the prostate. You can run inflammation in the rectum. Look at all the tissues in the area. So you place the contacts. I'm not sure how they applied the radiation, if they just put seeds in the prostate or if they did targeted radiation from the outside. You have to follow the beam. So you can have the blood vessels. Radiation is the gift that keeps on giving because it damages the DNA. So you treat 54 and 10, the two radiation frequencies. That causes DNA damage, which causes the immune system to recognize it as foreign, which causes ongoing inflammation, which causes ultimately scar tissue. And so I get them when they're way down the line. So scarring in the rectum, scarring in the anus. So you put the contacts behind the scrotum. So just basically have him sit on a washcloth and put the other washcloth on the just above the pubic bone. So the current goes through the whole area. And then look at how they did the radiation. So was it from the outside, from a beam, or was it from seeds placed in the prostate? But you say prostatectomy, so they took out his prostate, so they didn't do seeds. Yeah, so you treat the bladder and the urethra and the bladder sphincter. We have frequencies for all of those. The rectum, the nerves, the capillaries, the arteries, and you actually do need to reduce radiation in everything. I guess if he doesn't have a prostate, you're not going to be removing radiation in the prostate, but just all the other, it's the collateral damage that's more of a thing. Okay. Lisa, yes, we do need more well-trained, open-minded, biological, holistic dentists. And your opinion is not humble. It is shared by me and Mary Ellen and a whole bunch of dentists. So you need to search 3D cone beam near me and see what you get. Annie, who's the ophthalmologist? He's in Oklahoma. No, Utah. He's in Utah. Avoid Ed Condrot. Never mind, but he does homeopathy and homeopathy is nice, but yeah, he charges $8,000 for a weekend course that includes an Inspiristar and a bunch of homeopathy. And I think that's immoral. So that's just me. We've got an ophthalmologist in California who's been to the course recently. I know what I'm missing is the lights above me are not turned on. There's an ophthalmologist in California. You can check the website, I think, under Find a Practitioner and maybe find an ophthalmologist that way. Okay, hang on one second. Lisa, concussion in vagus actually turns the vagus up, and you generally don't. I don't use it when there's an active infection that I know about. What's comforting, though, is that your midbrain and your vagus will turn if there's an infection, the little pathogen-associated molecular patterns will turn the vagus down pretty much faster than you can turn it up. So there's not a whole lot of risk. It just won't do any good. So run concussion, run immune support. And okay, Lori, targeted, started 3 days ago, tattoo on the front, probably just above the pubic bone. Yeah, go get them. The scar tissue from that is just nasty. And it just creates ongoing scar tissue. And they forget to mention that radiation is oncogenic. So they hang on, is requesting a bypass the system private window sticker. No, guess I have no idea. Kevin, find out if I just did something bad. Where was I? Yeah, the radiation is oncogenic. So they've changed the survival statistics from 7 years to 5 years, because when they use radiation, the secondary cancers show up between 5 and 7 years later. So that's a thing, but that's standard medical treatment for cancer. And yeah, that's a thing. So go ahead and treat, stop the inflammation, use 54 and 10. I'm not sure if it helps, but it reduces the pain. Imagine sunburns inside. That's kind of how it works. So peeing and having bowel movements becomes pretty painful. Sometimes they'll insert a catheter during the radiation sessions so that they keep the urethra open and so it doesn't hurt quite so much to pee. Be sure and include the bladder and the urethra and the bone. You've got the pubic bone there, you've got the rectum there, you've got mucosal tissue there. There's a lot of tissues in that area. Okay, Annie, look, I want to send a client. And the other thing you can do is call the girls at there we go. View, here's from Kevin to everyone. View advanced search options, practitioner types, OD, that will give you optometrists and ophthalmologists. Leif Erickson, hi. Conrad has been known to sell black box protocols that are total nonsense. Yes, he sells pre-programmed Inspire stars. And what's your uncle's name? Anyway, his ophthalmologist uncle deciphered the black box protocols, and it didn't turn out they were effective. Okay, let's see. Kathleen Casman. Hi, Kathleen. 67-year-old female, nasal surgery 5 years ago, recently diagnosed with gram-negative strep in the suture line, has Marcons. Whoops. September, October of 24, month. Ooh, yuck. Month. Global exposure to mold during. No DVT-like symptoms, but no DVT. Okay, do a urine mold test, call the Time Labs, or I don't know if non-practitioners can order them, and see if she has mold colonization in her body. But Marcons, if she's already been diagnosed with Marcons, then the treatment it's a nasal spray. I've got the recipe someplace. Wait a minute. I've got the recipe in my notes because I've been using it for, years. Old nasal spray. There we go. The mold nasal spray recipe, everybody get a pen. Amphotericin B, which is not used orally anymore because it's so toxic, but if you put it in somebody's nose, it's not bad. It's 0.25%. That is a serious antifungal. They include EDTA, 0.75% to dissolve the biofilm that the mold creates, and mupirocin 0.2% antibiotic in 30 mLs of sterile water. Saline is more comfortable, and it's compounded, and it can be expensive. The amphotericin B is the expensive part, I think. You can alternate that with Argentum 23. It's a silver solution nasal spray. It took me, I don't know, 3-5 years, something, big spray. And that is, they call it big spray, and it's EDTA. Not sure what the G stands for, but the recipe is amphotericin, EDTA, and mupirocin. And then you have to deal with the mold if she's still got mold in her sinus. I don't know. Yeah, you have to find out if she still has mold and include binders and antifungals oral to deal with the mold. DVT symptoms, but no DVT. That doesn't make sense. So she had a D dimer and it's 0. And ultrasound is negative. Makes you curious, doesn't it? That's weird. Hi, JJ. And Julian. And Kathleen. Look at that. I just love FSM family. Okay, where are we? No, you okay? Let's see. How do you spell the third ingredient? Oh, mupirocin. M as in Mary, U as in up, P as in Paul, India, MUPIROCIN, and it's 0.2%. It's an antibiotic. Binders, oh yeah. So the compounding pharmacist will know how to make it. It's pretty standard. And oh wow, yeah. The binders, this is from, who's that? Annie. The binders have to start carefully. I have a patient now that is having to, Loris, that's right, Lewalder, now deceased. I know he passed away a couple of years ago. Back to binders, mold binders. She can't take binders, she says. And it's as long as you have mold, colonization, you are going to have digestive problems and MCAS. And whatever else happens to you when your vagus nerve is turned down and your sinuses are infected and whatever. So the binders, Shoemaker doesn't like antifungals, but I've been on them for, when we came back from Taiwan and Australia, I had 6 species of mold. Now I'm down to just Stachybotrys and that I picked up in Taiwan. And so I'm on chlorella, which is specific for Stachy. And I have a patient that can't tolerate like 1 tablet of chlorella. I'm up to 3, so I know I'm doing pretty well because that does make me sick. And so the patient who can't take binders, you get chlorella powder, and you start them on 1/8 of a teaspoon. And 1/8 of a teaspoon of chlorella, that's specific for Stachy. You can get bentonite clay as a powder, and you take 1/8 of a teaspoon or less of that. And charcoal outside of a capsule is pretty obnoxious, so yuck. But you just have to start them really slow. You don't chlorella, yeah, the binders have to be used carefully. And I don't know why it would cause, for me, Neil told me to take 3. I took 5 because the package said to take 15. And after 3 days, I was a crazy person, just completely anxious. And so I got busted for that. And I called him and told him is this supposed to make me feel anxious? And he said, how many are you taking? And then I had to tell him that I was taking more than he said. And then I got in trouble. And so he said to go off of them for 3 days and then I could tolerate 1 chlorella, 1 clay, 1 charcoal. I took all 3. And they bind the mold in the gut. And sometimes that causes the mold to release more of the mold toxins. And it's a long-term process. It's a marathon, not a sprint, as Kim would say. The lady that Kathleen, the DVT lady that Kathleen was talking about, hi, JJ, was stung by a jellyfish. I'm assuming the jellyfish sting might have been in her leg. So in the advanced, there are frequencies for poisons and toxins and necrosis. So you can look up, what does a jellyfish toxin do, and see if it damages the lining of the blood vessels. Also find out if she was vaccinated for COVID or got COVID. That damages the lining of the blood vessels and makes them rough and lumpy instead of smooth. And so you can run poisons, toxins, and the COVID frequencies, and trauma, torn and broken, and increased secretions and vitality in the arteries and veins, and see what that does. What are these oral binders besides chlorella? Bentonite clay and charcoal. Those are the ones I know about. I had one unfortunate patient that came in and was treated by somebody who told her that glutathione was the treatment that would kill the mold. The problem with that is that glutathione releases the mold from where it's stored. She thought the mold was out of her body, and she was still really having troubles with digestion, depression, anxiety. It didn't go well. Zeolite is another binder, true story. What's the other one? There's another one too. Cholestyramine, if you can tolerate it. Call if you can tolerate it. The sensitive patients, those are too strong. It doesn't go well. But zeolite sounds like it's one of those where the toxin adheres to it. It sounds like it's in the clay or, diatomaceous earth, maybe, in the clay or charcoal family, Alf. So the mold webinar I worked on with Neil, I basically took Neil's slides and made the mold webinar, so you can look at that as a start. There may have been some advancements in the treatment of mold, but you kind of have to watch out for things that are just moneymakers. So there's that. This the Marcons is a pain. It's difficult to get rid of. And you basically have to have a nasal swab to diagnose it. Kathleen's patient already had the nasal swab, so we know that it's Marcons. But Marcons tends to go along with mold infection. Okay. Klein. I recently treated a 17-year-old diagnosed with atrial fibrillation, which is what they call supraventricular tachycardia. That is the thing that is above the ventricles is the atria. So I'm thinking atrial fib. She's had it for 3 years. Her heart doctor was recommending an ablation over lifetime meds. And the problem is that lifetime meds don't work very well for atrial fib. They put them on beta blockers, which does keep the ventricles from getting entrained and putting them into a generalized tachycardia or arrhythmia. Her mom was referred to me. I asked her if anything had happened prior to the condition. She was hit in the mid-chest while playing flag football. It started immediately after that. That's a thing. Treated her once with a concussion in vagus and vagal tone 2 weeks ago. She's had 2 or maybe 3 to 5 second incidents since then. Yes. Treat her at least one more time. Yes. No one ever asked that question before. Thank you. You're welcome for teaching you to ask that question. Yay. Are there any other things you would add to the treatment? If you want to keep the vagus functioning, huperzine A is acetylcholine, but when you treat her again and get to the mom, tell the mom, I need to treat her again, and treat the vagus for trauma and maybe scarring. Okay, so if you think about what happens when she gets hit in the chest right here, the vagus is right behind the sternum. So there's one on the front of the bronchi and one arm of it on the front of the esophagus. Or maybe it's the back of the bronchi and the back of the esophagus. But anyway, the vagus is right there in front. And so you treat the vagus for trauma and maybe scarring. Scarring in the vagus, scarring in the bronchi, scarring. I'm going to guess she has some difficulty with digestion as well, although it's the right vagus that does the atria. Oh, that's right. Annie is an expert on atrial fib. Hang on. So treat her again, treat her, and then run increased secretions in the vagus and trauma in the vagus for longer times than are in the vagal tone protocol. So you treat the regular vagal tone protocol, but you go into the mode bank, protocol bank, and modify it if all you have is a custom care, and increase the time on trauma to probably 5-10 minutes, and then increase the amount of time for increased secretions from maybe 10 to 12 minutes, and then treat scarring. And scarring in the vagus, the heart is always pumping. So that whole area is always moving. So that's a thing. Okay, if it's supraventricular tachycardia, they usually don't have a rapid ventricular response. In my years of it and treating others, some survive well on meds. They ceased to work for her. The new PFA ablations are doing well in experienced hands. Yeah, George had an ablation. He had atrial fib. That's what ultimately killed him because he wouldn't take anticoagulants. And I've seen a few who did do well with AFib when it wasn't rampant. Always worth a shot. Digestion too. Look at hiatal hernias. Annie, you have more experience with atrial fib than anybody I know. So there are different varieties. If this kid did really well with just one session of concussion in vagus and vagal tone 2 weeks ago, that's very promising. So I'd say treat her again and add huperzine A, and as Leaf said, increase magnesium, and would be magnesium glycinate, not citrate. Citrate's a good laxative, but it's not absorbed. So magnesium glycinate, I would think, for heart, malate for muscles. Any chance what makes someone a good host to parasites? Yeah, a digestive system, basically. Everybody is susceptible. It's some of them just, that's a really good question. I actually don't know. I know somebody gets sick with traveler's diarrhea gets a parasite, nobody ever treats them with an anti-parasite medication. And Lisa says, shouldn't they technically come and go and not set up camp? Oh, no, if you are a parasite and you have all these little villi in the gut, and you have the appendix, and you have the cecum, and you have the sigmoid, and you have the gallbladder. You have all these places to hide out. You can hide out in the bottom of the villi. They can hide out there. And yeah, why would they leave? The immune system in the gut can only do so much. And if they come and go, what I have run into is silent parasites years after. And the parasites create an infection. So the patient had traveler's diarrhea. He was in the Middle East, got traveler's diarrhea. It went away. But then a couple of months later, he was diagnosed with Crohn's. And that's because the parasites turned down the vagus, and the immune system was supposed to be able to kill them. But I don't actually know the question to that. I only see the people where the parasites are missed and nobody ever treated them. So I've had mold, I've had the root canals, I've had all that stuff. And I have an autoimmune condition that came up. And Simon, you remember Simon? When he lectured at the symposium a few years ago, he did his electrical testing on me and recommended a regimen of anti-parasite medications at 3 to 5 times the normal dose, and 5 of them all to be taken at one time. And my GP looked at the list and said, it'll be $20,000 for the month. And I went, that's assuming I survive it. And then I went to my naturopath and he said, what if we do Klinghart's regimen for anti-parasite medication? The challenge with parasites is they lay eggs. So the regimen that Klinghart recommends is 5 anti-parasite medications to be taken in sequence, one of which is ivermectin. So there was mebendazole, paracetamol, something else, and then ivermectin, and then Alinea. And then you wait 6 weeks because that's when the eggs hatch. And then you repeat it all over again. And I took them as I should, 3 days, 5 days. And when I got to the ivermectin, you know how you stand up after a bowel movement, you look in the toilet. I looked in the toilet and there was this white fuzzy ball. And I went, that's not normal. And that was the only anti-parasite medication that caused anything strange to show up in the toilet. Worms and parasites are endemic in the United States and Asia for sure. The Middle East, it's a thing. Yeah, no, I don't know how the immune system can't get them, but if the patient gets traveler's diarrhea and then has ongoing health problems afterwards, it's something to look at. And the problem is that ONP, ova and parasites, so they're looking for the worm itself or an egg in a tablespoon of stool and a medical stool test. That doesn't work. There are DNA tests for parasite DNA that are more effective now, so that's good. But if you can get a GP like mine or a naturopath like mine that's just willing to do it based on your health history, they can do it that way. The anti-parasite medication is not easy on your liver, but it's not usually going to kill you either. Heart's on the left of the chest. Oh, Louise, if the heart is on the left side of the chest, can you explain how treating the right vagus is appropriate? It's how the vagus is wired. So the left vagus is in charge of slowing the ventricles. So there's a sympathetic vagus, sympathetic, parasympathetic balance that keeps the heart rhythm in order. There's the electrical system in the heart itself, and there's the nerves that go to it. So the anatomy of the vagus is the left vagus goes to the ventricles, and that's how I remember it, is the heart's on the left, and the left vagus goes to the ventricles. The right vagus goes to the atrium. But truth of the matter is we're treating from the neck to just below the sternum. So you're treating both arms of the vagus at the same time. Hang on. Oh, yeah. Decreased hydrochloric acid, and that's the vagus is in charge of hydrochloric acid. And lots of sugar will increase susceptibility to parasites, mold, all that stuff. Sounds like Alf has some experience with parasites, dogs licking your face and sleeping with cats, and cats walking on the countertops. I'm in big trouble because we have dogs. We can't feed the cats on the floor, so the cats know to jump up on the countertop, and that's where their food dishes are. Okay, then. Leaf says fenbendazole for parasites too. Almost all of the parasite medications end up with azole, metronidazole. That's Flagyl. Oh, that was the other one I forgot. Paracetamol. Ivermectin must have a generic name for it that ends in azeole. So that's cool. Okay, wait a minute. It's 4:00. Get out. It is. It's 4:00. Just a second. Thad, I can't. Oh, run TTH. It appears that AFib can arise with either sympathetic or parasympathetic triggers. Yeah, you turn off the vagus or turn up the sympathetics or the receptors. You have to remember that every time there's a nerve, there's a receptor. And that's why huperzine A is what we use to make the vagus work better, because it keeps acetylcholine in the receptor nerve synapse for longer. It's an acetylcholinesterase inhibitor. It's a medical thing. Kevin says, run TTH if you think the parasites are targeting you. Oh, thank you, Kathleen. I'm glad you like it. Speaking of which, Kathleen said it's like a masterclass. Speaking of which, we are doing a masterclass this fall. I think it's, Kevin, October, masterclass in Troutdale instead of Hawaii. Next year it's in Hawaii in August at Derek's. Derek isn't here, so he can't defend himself. September, Patricia says, no, can't be September because we're in, wait, no, you're right. It's the 6th. Oh, it is. It's the 6th and 7th of September. And for those of you that are thinking of coming, it's the way the masterclass works. It's like this. It's 6th and 7th. Thank you, Lori. It's the 6th and 7th. It's like this. You don't have to be an advanced practitioner. You don't have to have taken the advanced, although that helps. It helps if you've been practicing for a little bit so you have enough questions to ask. Because the way the masterclass goes, it's whatever you need to feel mastery in whatever area of FSM you want to be a master of. And I made reservations at Edgefield for a room for me, but that means that at the end of the day, bring your bathing suits and we can go to Edgefield and get in the hot tub. And the hot tub at Edgefield is like a lazy river. It's, I don't know how many, maybe 60 feet, that sort of winds around in this nice little tree-lined area. It's my favorite course. And we're now definitely on McMakin time. It's 4:06. So thanks everybody for East Coast Masterclass. Yeah, one of these days. Thanks for coming. It was really fun talking to everybody. It's nice to see you. Do good things, make lives better, and take care of yourselves. Bye.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.